So while I'm talking, we're going to talk a little bit about nutrition and just kind of overall general recommendations and just some specific for MSA. All right, there we go. It decided to work. Let me pull it up real quick. Okay, can you see it? And I can't see you, so someone give me a yes.
We can see you.
Can you see my screen?
Yes.
Okay, cool. All right. And this is very, very laid back. And so I do have like questions at the end, but if you want to stop me at any point and ask me a question, I'm more than happy to just address it while we talk. Without further ado, when we think about nutrition and the diagnosis of MSA, um, unfortunately, as far as general diet recommendations, we kind of have to apply those because when we look at, oops, sorry, when we look at overall recommendations, uh, there's not a lot out there. So today we'll talk about generalities and then we'll talk about specifics of constipation, blood pressure, difficulty chewing, swallowing, and feeding tubes. And then the questions and answers. So when we look at research, I get a lot of questions from my patients as far as what should they be eating? And the current research is very limited with MSA. Most of it is specific to symptom management versus prevention. If you ever Google or we ever ask Dr. Google for what we should be eating, there's some generalities with neurodegenerative diseases. There's some information as far as a neuroprotective diet. There was a study that came out just recently, the last year, specific to MS, looking at diet recommendations that might help slow progression, but nothing necessarily specific to MSA in general. So we kind of have to look at the information and look at overall general information and decide where we want to go from there. So overall, when I talk to my patients, one of the main things we talk about is maintaining their weight, being at a healthy weight, and specifically maintaining their lean body mass. With MSA and also with other neurodegenerative diseases like ALS, loss of muscle is something that can occur. But it's my job to make sure that my patients are eating okay and getting enough of the good things to hold on to the lean muscle mass that they have, and that diet isn't related to the loss of muscle. And then, of course, we are what we eat. So making sure that we're eating those good things that are going to make us do well, make everything function well, and give us the energy we need to do everything that we want to do. And so those are foods like whole grains, fruits, vegetables, and lean protein. So, what should I be eating? Thinking about that. And if we look at all the current information out there and we look at what might help with inflammation, what might help with this, we always kind of circle back to the Mediterranean diet. And there's some research that shows that eating like this may help control inflammation. There's no information out there specific to MSA and the Mediterranean diet, but honestly, if we think about what we should all be eating, me, you, Amy, Dr. Bernino, everyone, a Mediterranean diet is really a very healthy diet. And of course, it's a pyramid. And so at the bottom are the things that we should be doing all the time. And then we move our way up towards the top of things that we shouldn't do all the time. So at the bottom, activity if you're able to, but this is also kind of I like to think about this as doing the things that you want to do. So mental health, spending time with your family, spending time doing things that you want to do and make you happy are things you want to practice daily. And then as we move up the pyramid, incorporating every day those whole grains, legumes, fruits, vegetables, healthy fats, those really good herbs and spices that also have good disease fighting properties. And then having fish, seafood, those omega-3 rich foods, including walnuts, at least 3 times a week. And then poultry, eggs, and dairy, 1 to 2 a week. And then red meats and sweets. Those are those on occasion kinds of things. So let's dive into this a little bit more. What are whole grains? Usually when we think whole grains, we think whole wheat bread, but there's more than that. And there's things that they do. They provide us good fiber, which supports a healthy gut. They also have good vitamins like niacin, folate, and thiamine, minerals like zinc, iron, magnesium, manganese, as well as good antioxidants and phytochemicals. A lot of vitamin E in these whole grains, and that's good. And these are just an example. Like I mentioned, whole wheat, that goes without saying, but there's lots of other different sources of whole grains too. So popcorn is a whole grain, not when it's loaded down with butter and like the movie kind of popcorn, but just air pop popcorn. Quinoa, which is a good protein too. Brown rice, teff, which also has some protein in it. Farro, bulgur, barley, sorghum. I think we're starting to see these a little bit more in the diet and when we go out to eat at restaurants. But there's nothing wrong with just oatmeal too, and whole wheat bread and brown rice. And so if you're wanting to think about ways to increase this in your diet, you can add, oatmeal to your cereal or yogurt. I mentioned that air pop popcorn, using the brown rice. And they do make brown rice that you can cook in the microwave. That only takes about 90 seconds. Sometimes when I cook it on the stovetop, it takes a long time. So there are faster ways to make it. Or, you can swap out that white rice or whatever grain for quinoa or farro. I did have a farro risotto at a restaurant about a month ago, so I thought that was kind of interesting. So we are seeing it a little bit more often. You can add barley to soups. You can swap out if you make something with flour, you can use whole wheat flour. If you like tacos or use tortillas, you can use the corn tortillas instead of the white ones, the white tortillas, and that would increase the quality and increase the whole grains in your diet. And then moving on to fruits and vegetables. So of course they have fiber, and there's different kinds of fiber. There's a soluble and insoluble. Insoluble is the roughage. It's like those, the skins of the apples and the dark green leafies. They provide bulk for us. And then there's the soluble kind of fiber that is more of like a jelly type fiber. It's more, it kind of provides the glue and helps things move through our body more easily. So you want both in your diet. So fruits and vegetables have this soluble and insoluble fiber. They also contain what we call antioxidants and phytochemicals. And these are properties in fruits and vegetables that provide all sorts of good disease-fighting properties. And kind of thinking about when you choose fruits and vegetables, we'll talk about this a little bit, get a lot of color so you get a lot of different kinds of antioxidants and phytochemicals. They've also found that by swapping out unhealthy foods for your fruits and vegetables, that can help with weight loss. So if that's something you're looking for, that can be a switch, plus increasing the quality of your diet as well. So things to think about when trying to get more fruits and vegetables. Sometimes having those visual cues is really helpful. So keeping it on your counter or having prepped in the fridge for an easy snack. Those little cuties are always really fun to eat. We have bananas out on our pantry. I have baby carrots in the fridge too to grab for an easy snack. Or sometimes setting goals for quantity. If fruits and vegetables isn't something that's currently in your diet and you're wanting to increase that, you can, set a goal of maybe trying to have one fruit every day. And then once that's good, maybe add a serving of vegetables every day. Overall, we should be having at least 2 servings of fruits and 3 servings of vegetables every day to get all those good vitamins and phytochemicals and antioxidants in our diet. But sometimes it's easy to start small and think about, well, I'm going to, swap out my trying to think about my patients this week, my Rice Krispie bar for a couple cuties instead or something like that. And these are just some examples of a serving of fruit or a serving of vegetables. For the most part, if you think about your fist, that's about a cup. That's about a serving. That's a nice size for an apple or a pear, small, about half a banana, a cup of leafy veggies. So kind of trying to aim for the size of your fist is sometimes helpful. Other things you can do is think about just trying to get different colors and fruits and vegetables in your diet, or incorporating some meals that are higher in vegetables, like soups, especially on a day like today where it's a little bit chilly. You can add lots of veggies to that soup or have a salad with cucumber and broccoli and tomatoes and maybe more of a farmer salad, or using a stir fry. That's where you could use that brown rice, and then you could add lots of veggies for that. So the next thing we want to talk about is protein. And this is very important, and it's the building blocks of your diet. It makes up your hair, it makes up your muscles, your tissues, your organs. Those are all important. So we want to make sure that we're getting enough protein to hold on to those. It also helps repair cells, and it provides essential amino acids that are needed to do everything that our body needs to do. So what are some good sources of protein? Lean, of course, animal meats. Yes, so fish, poultry, red meat. And red meat's anything with 4 legs. So, if you're old enough like me, you remember the Pork Council did a really good thing about pork being the other white meat. It's not, it's a red meat. So while we want to incorporate adequate protein in our diet, if we're wanting to do more of an anti-inflammatory diet or more Mediterranean diet, we want to keep that to maybe once a week, and choosing more fish and more poultry and more vegetarian sources of protein. And of course, there are vegetarian sources of protein like soy, beans, nut butter, seeds, and whole grains. I mentioned the teff and the quinoa as being sources of protein. And then we have our dairy group: milk, cheese, yogurt, eggs. And then there's other sources of protein as well, such as those protein powders, protein bars, shakes. And then there's some of those meat alternatives like Impossible or Morningstar Farms, or some of those other ones that are made up of non-meat ingredients. So as we talked about, it's important to make sure you get enough protein in your diet to retain your lean body mass. Unfortunately, as we get older, aging is considered a low-lying state of inflammation. And so our needs for protein are a little bit higher. Not insanely, incredible sources, but enough that we want to make sure that we're holding on to everything that we have. So too much protein can, if you're not using the calories, there is calories in protein as well. It can convert to storage. So you want to make sure you get enough protein, and we'll talk about what that looks like. But kind of a nice rule of thumb is about 7 grams of protein per every 20 pounds of body weight. So if you are someone who weighs 100 pounds, so that's 20, 40, 60, 80, 100. If we do math, 5 times 7 is 35. Not a whole lot. So that would be the minimum of what that person would need. Probably, just depending on everything else, I'd probably go up a little bit more, but that's my wheelhouse there. So things, if you're having difficulty getting enough protein, one thing you can do is think about eating your protein first. So some of my patients aren't very hungry or may have more difficulty getting enough to eat. So encourage them to make sure that they, when they do eat, that they choose that protein food first. So if they do get full, at least they got that good stuff. Snacking on cheese instead of cereal with the morning, you can have eggs instead. Adding chopped almonds to whatever you eat. Although burgers would be weird, but like a salad or oatmeal or your yogurt, that can increase the protein. Choosing Greek yogurt. For most of them have about twice the amount of protein than a regular yogurt like Yoplait or Dannon. And it's the same volume. So that would be another way you could increase the protein in your diet. Have a protein shake for breakfast or sip on one during the day. Sometimes it's too much volume. Sometimes the shakes will interfere with my patient's appetite. So we kind of think about how to incorporate that throughout the day to still get that good protein in. I love peanut butter. I'm a big proponent of it. So so that's another way, it's healthy fat, which we'll talk about. It's good protein. You can add it to shakes. You can put it on English muffins, have it as a snack, put it on some apples. But that's another way you can increase protein besides snacking on cottage cheese, munching on edamame. Canned fish is a real easy protein. We also have the pouches, if that's your preference too, but that's something you can just easily open and it's good to go, and it's very good protein, about 20, 21 grams of protein per 3 ounces. So we talked about the whole grains, making sure you have protein at every meal. And then if you're able to, maybe choose just a little bit of a bigger portion when you do have that protein food. So the last thing, we talked about the Mediterranean pyramid. the whole grains, the fruits, the vegetables. So let's talk about fat. Um, these are dietary fats, and they're important, and they're broken down in our body into fatty acids, and they're utilized by our cells. They help absorb fat-soluble vitamins like vitamin A, which we need for eyesight, vitamin D, which we all know can be linked to overall health, vitamin E, which is a good antioxidant, and vitamin K. It also supports cell function, it gives us the energy we need, and it protects our organs and keeps our body warm. So we want to make sure that we have some fat in our diet. But there are good fats and bad fats. And we want to make sure that we're choosing those fats that are going to be healthy for us. And so those are the monounsaturated and the polyunsaturated fats. And if you look at some of these examples, or when we think about olive oil or canola oil or peanut oil, all of those oils are liquid at room temperature. So that's one way you can kind of tell that it's a healthier fat, because it's liquid at room temperature, except for avocados, those are different. But the bad fats are the ones like saturated fats that are not good for cardiac health. And there's some thought that they may be related to overall inflammation. And if you think about saturated fat, that's like butter, coconut oil, ghee, for example. And those are more saturated fats. While they're quite tasty and fun, we want to limit those and choose more of the healthier fats. And of course, this is just an example. The olives, olive oil, peanuts, nuts, seeds, avocados, fish, and then whole grains as well have some vitamin E in them as well. So things you can think about when you're wanting to incorporate more of those healthy fats is using, going for the avocado toast in the morning instead of the butter or the cream cheese, snacking on guacamole, using olive oil in your bread, tossing that whole grain popcorn with some olive oil, substituting olive oil for butter, roasting vegetables in olive oil. This is a favorite of mine. And also one way, if you're not a huge vegetable lover, something about roasting vegetables kind of brings out more of a sweetness for a lot of them. So just throw in some olive oil with them and throwing them in the oven with a little bit of pepper and a little salt makes a huge difference. Using your own salad dressing, so maybe instead of a cream-based dressing like ranch, making an olive oil dressing, or you could buy one actually. I like Newman's olive oil dressing. I think it's really good. And then you could add those healthy nuts to have the healthy fats to yogurt, salads, cottage cheese, oatmeal, or just snack on them in general. Those are a great snack too, good protein and fiber as well. So if you're thinking about wanting to increase the quality of your diet, sometimes it's easier to just pick one thing or two things. Small changes sometimes make a difference over time than trying to completely redo everything. So it may be, trying to make sure you get that one serving of fruit every day. Or it may be when you have rice that you're choosing brown rice instead of white rice. Or it could be, that breakfast in the morning, making sure you're getting a little bit of more protein than just your sweet bun, something like that. But a variety is good. And if you are savvy with the internet, these are just a couple places you can go to for more information. Old Ways is a great reference as far as more information on the Mediterranean diet. And then there's the American Heart Association, and then My Plate, which has a lot of information on fruits and vegetables. So that just kind of gives you a little bit of overview when we think about what we should be eating, the foods that we should be choosing, and what they do for us. So then we're going to move on to just kind of some of the things that are common with my patients that we talk about a lot. Constipation is something that we talk about a lot. And usually my first question is are you drinking enough fluids? Because a lot of times they're not. And sometimes, not drinking enough fluids, sometimes mobility makes a difference. My patients are not able to be as active as they normally are. That can affect movement as well. And then maybe they're not able to eat as much as they used to for, lots of different reasons. So we'll go through the fluids. We'll talk about increasing fiber. And of course, adding all those fruits and vegetables and whole grains that we just talked about. Some of my patients find that using a supplemental fiber is helpful, such as Metamucil or Benefiber or Citrusel. These are examples. There's lots of different ones out there. These just happen to be the most common ones. Some of these work better for my patients than others. Whenever you're adding a supplemental fiber, just remember you have to drink more water to make it work, or else it will just sit in your stomach. And you also want to incorporate fiber slowly over time. Most Americans consume about 11 grams of fiber per day. And so if you went from 11 grams of fiber to 25 or 35 grams of fiber in one day, you probably are not going to feel great. You probably would feel more bloated, more gassy. And so that's something that we want to encourage to add over time, and that way it can alleviate some of those symptoms. Other things we talk about, if we've gone over fluids and fiber, we talk about other things that are over the counter that might be helpful. Prunes are always fun. I have some patients who've had really good results with those. Prune juice, but if you're not a fan of prune juice, there's something out there called plum juice, which is actually really tasty. You have to stop yourself from drinking so much because it's pretty good. There's something else called Smooth Move tea, which is a tea that has senna in it, which is a natural laxative, so to speak. It has a little bit of push behind it, and then some other things that may help. And I've had some patients who've had good results with this. Probiotics, you can find them in yogurt. Activia has specifically branded their yogurt as something that can help with constipation. I've had some patients who have done well with that. These are just a couple other brands that patients have told me has been helpful: Align, Culturelle, Digestive Advantage. I think the research on probiotics is still kind of plus or minus, and some people find it's beneficial, some people find that it is not, and that probably just kind of goes down to what else is going on with us. But it's something that could be tried. And then there's something called Power Pudding, and it's applesauce, oat bran or wheat bran, and prune juice, and you mix it all together, and you can put it in like an ice cube tray and stick it in the freezer, and then bring them out like one serving at a time, and see if that can make a difference. And that's something that you can gradually increase every 3 or 4 days, and see if that provides some benefit as well. And you want to make sure that you drink it with water. And then just keep in mind that sometimes everything that we do does not make a difference. Sometimes there's other things going on with these neurological diseases. If you think about it, that also controls our muscles, which is our colon and our intestines. So sometimes we do need a little more help than everything else that we're trying. So that's where it's good to talk to your medical provider regarding what other suggestions, or if there's other medications that would be beneficial to help get things moving. All right. So the next thing I'll talk about is salt. And salt's something that can help my patients with orthostatic hypotension. But of course, this is something, and here's my caveat, you want to make sure you speak with your doctor to see if this is something that would be beneficial for you. The overall average diet of the American is about 3.5 grams of salt. And if you look at a little table, you can see 1 teaspoon of salt is about 2,300 milligrams. So that's about 1.5 teaspoons of salt. The Mediterranean diet recommends less than 2.4 grams of salt a day. But the overall recommendations for MSA are pretty broad. And when I looked into all the research, it just said more. And so my patients have had different recommendations for them, and that the research shows anywhere between 3 to 8 grams a day. But again, this is something that you want to talk to your doctor to see if this is something that would be beneficial for you. But if it is, then how do we do that? Well, it's the opposite of what I recommend my heart patients. Looking for food that's in packages, bags, boxes, cans. All of those good processed foods are usually higher in salt or sodium. So incorporating more of those into your diet can be a way that you can increase the sodium. There's also some rehydration solutions that are out there, and some of the more designer ones, or the ones that are newer, usually have about 500 milligrams per serving. So that's a significant for a rehydration solution. For some of the other ones are a lot lower. So that could be another way to increase the sodium in your diet. On the thinking about salt, I always think about dehydration. And this is something that usually when I ask my patients, how much fluid are you drinking? They always tell me that they're not drinking enough. And there's, different reasons for that. But just, some of the symptoms of dehydration are fatigue, irritability, dizziness, headaches, muscle cramps in the arms or legs. Some of my patients are not as mobile, so it's hard to get up. So they usually limit their intake because of that. And I usually nag at them because, if they're not drinking enough fluids, one, they're more at risk for urinary tract infections. And once someone has had a urinary tract infection, they're 50% more likely to have another one. So that's where making sure, one, that you're drinking at least 50 ounces of fluid a day to help with that, because you're kind of clearing things out, getting things moving. Dehydration can also increase the risk of falls and injury, and we don't want anyone falling. So it can cause confusion, lack of coordination. So it's very important to make sure you're drinking enough fluids. And if you're having difficulty doing so, please, talk with your provider. All right. Fluids can also help with orthostatic blood pressure, and they found that 16 ounces, just drinking 16 ounces in one time, can actually increase blood pressure by 30 to 60 points, but it can wear off in 30 to 60 minutes. So you want to be aware of that. And then on the flip side, if you have supine hypertension, you'd want to avoid water before bed. So, but if you're wanting to increase your fluids, some people have more difficulty drinking fluids. They could choose more foods that have a higher water content. So that would be like cucumbers, watermelon, lettuce, strawberries, tomatoes, celery, and then also incorporating, there's more liquidy foods like soups or broths or stews, especially for our last cold blast, I'm sure. Keep water with you always. I tell my patients, keep it out, keep it in front of you, take it with you. Don't take the same one bottle. Make sure you're trying to get more than that. Some liquids can be dehydrating. Coffee and alcohol. If you have a cup or two of coffee a day, great. But if that's all you're drinking, it may be a good idea to think about other ways you could get other fluids in besides just the caffeine. Sometimes flavored water is more fun. Sometimes bubbly water is more fun. I drink more Topo Chico. Actually, this is the HEB brand, but that makes me drink a little bit more. But flavoring it, adding mint, adding fruit. There's lots of different ways you can flavor water, like the Mio drops or other things. And sometimes the flavored water makes it more enticing. And then also building hydration into your routine. So making sure, when you're at a meal, you always have a glass of water to drink. Or if you're going to sit down at your computer, you need to make sure you have that water so it's right there and it's queuing, and it's a habit while you go through your email. Drink your water. I have some patients, when they wake up in the morning, they have a glass of water, and that's their routine. So building it into your routine to make it part of your habit so that you're getting enough fluids. And then let's talk about weight. Weight's a balancing act, and for everyone, it is. So rapid weight loss can cause a decrease in lean body mass, and that's what we don't want to happen. So my patients who have challenges not getting enough nutrition can cause more fatigue, a decrease in energy. And then on the flip side, I have some patients who are not as active as they used to be, but they continue to eat the same amount of food. And so sometimes that can lead to a little bit more weight. So, and then more weight can sometimes affect mobility. So that's why I encourage my patients to try to keep their weight stable if they're able to. If my patients are having difficulty weight and not getting enough, there's lots of different reasons: decreased appetite, they're more tired, so they're not eating as much. Some of my patients have postprandial hypotension. If they eat a large meal, their blood pressure drops. So sometimes small, frequent meals can be helpful and beneficial with that. And this is just an example. But you can see it's not anything that's really big, but it's something just kind of doing over time. And sometimes this helps if you're not having a great appetite. Sitting down to a large meal can be overwhelming. So sitting down to a small snack of some cheese and crackers, or some fruit and some peanut butter or something like that, and doing that every 3 hours can be helpful. And then some of my patients have difficulty chewing. So I encourage them to change up the texture. Thinking about making things more soft, overcooking foods. Like if you think about a carrot, it's pretty hard just raw, but if you cooked it pretty well, then it would be nice and soft and fork tender. And that's kind of a nice rule of thumb. Anything that you can cut with your fork is maybe easier to chew. Making sure that meats are more moist by cooking them in a moist method like stewing or braising, cutting foods up well so you don't have to spend as much time chewing here if you do more work cutting it up. You want it to be kind of the size of the tip of your pinky, if that's helpful. If it's difficult to use a knife, you can use like a countertop chopper, like a food chopper, and that can cut it up as well. And then just be mindful of reheating foods in the microwave because sometimes that can make it more tough. You can add sauces and gravies to make it moist. Choose soft proteins, fish, ground turkey, chicken thighs, they're a little higher in fat, but they taste better. And they're a little bit softer too. And then like Greek yogurt, cottage cheese, eggs, tofu, those are all softer proteins to make sure you're still getting the protein, but it's not as hard to chew. And then fruits, making sure you're avoiding the peel or choosing canned fruits, which are a little bit softer. And then sometimes fruits that have a lot of water, like watermelon, while we think that might be helpful, sometimes it can be more difficult to chew. So difficulty swallowing is something that can occur as well. So cutting foods up well, again, that pinky is kind of a nice guide. And then sometimes foods that have mixed, kind of like mixed media, like chicken noodle soup or cereal, where you have a solid and a liquid, sometimes that can be confusing. So avoiding those foods, or if you have a soup, blending it up and making it one consistency or draining the milk off of cereal can be easier to swallow. If you notice that you're needing to clear your throat when eating solid food or feeling like when food gets stuck, difficulty swallowing tablets, coughing after drinking liquids, choking on solid foods, or have a wet or gurgly voice after having a drink, you do want to let your medical provider know so that they can, maybe you need to be evaluated. Maybe we need to find out what else is going on to see how we can best help you. Some of my patients, because of the difficulty swallowing, because they're having possible aspiration or the food is going down the wrong way, or they're having challenges getting the nutrition they need for other reasons, may need a feeding tube. So I want to touch on this a little bit. And some of my patients haven't ever seen a tube before, so we usually go through what it looks like. It's a standard feeding tube on my left, and then kind of a low profile feeding tube on the right. And it's just a device that's inserted into your abdomen. It can be an avenue for nutrition and hydration. It doesn't mean that you have to stop eating. It means that it's another means to provide the nutrition that you need. And it's okay to eat and drink if it's safe for you to do so. It's usually an outpatient procedure. You can use it 4 to 6 hours after placement. Some of the places my patients get tubes have them wait 24 hours, but technically you can use it 6 hours after placement. And what goes in it? Water, of course. Medications can go through it. So if those are difficult to swallow, that can be another way to get your medications. The only thing that cannot go through the tube is medications that are extended release, because if they're supposed to be released over time and then you crush them and put them through the tube, then you get all of it at once. So that's still something that has to be given by mouth, but medications that can be crushed or in liquid can be given through the tube. And then my patients want to know what goes in them. There's lots of different kinds of what we call tube feed or medical nutrition, food. There's a more of a standard one like Jevity or Nutrin. There's some that are organic. There's some that are just food. It's basically like blended food. There's some that are vegan. There's some that are more like the real food blends, but blended up a little bit more. So there's lots of different kinds. But they're all formulated with protein and calories and vitamins to make sure that the patient's getting everything they need. And then my patients want to know if they have to get a feeding tube. And I tell them it's their choice. It is definitely a discussion to have with your dietitian, with your physician, if you have a palliative care doctor, to really discuss the benefits of having a feeding tube, or if it's something that you don't want, understanding that process. And that's kind of a little bit of everything, the things that I talk about with my patients, things that come up. If y'all have other questions, I'm going to stop sharing my screen so I can see you, and please let me know if I can answer anything. Oh, we have more people.
That was very, very informative, Alicia. Thank you so much.
Sure.
Anybody have any questions that she can answer?
Well, it is nice to see some faces out there that I know. And it's nice to see some new faces of people that I don't know. So thank you for having me, Amy. I
Thank
love
you.
talking about food. I love talking about nutrition. I could talk about it forever. So thank you for having me.
Well, thank you so much. Just a couple of quick things. My email address is in the chat. If you'd like to be included on our mailing list, we try to have an educational session once a month. And next month on April 27th, we're going to have a discussion about sleep issues with MSA. So if you'd like to get added to the invite list, just grab my email address out of the chat. It's amy, amy.conger, conger, at utsouthwestern.edu. And I'll be sending out the invitations for that meeting in the next couple of weeks or so. Anybody before we say goodbye for the afternoon? Okay. Well, thank you so much, Alicia. Everybody, thanks for joining. Hope to see everybody next month. Have a good weekend. Bye-bye.
Bye, everyone. Oh, go Cowboys.